Vaccinations against COVID continue to ramp up in Canada, and despite the positive outlook, there are questions about how long those vaccines will offer us protection. Will a booster shot, for instance, be required? Pfizer and Moderna are working to develop what would be a third dose, but many experts say evidence is still required to prove that those additional shots would actually be needed. Kate O'Brien is the Director of Immunization and Vaccines at the World Health Organization. Dr. O'Brien, what needs to be considered in determining if vaccine booster shots will be required?
Well, there are a number of things that we need to figure out. The first is how long do the doses that people have already received, either the 2-dose or 1-dose regimen, how long they last. That's the first thing. The second thing is about whether they are also going to retain their effectiveness against these variants of concern that are circulating around the world. And those are really the two biggest things that we're still waiting to understand the full data on.
So when we hear the CEOs of Pfizer and Moderna both saying that booster shots are likely needed to protect against variants, is there the evidence right now to support that one way or another?
We're still in the early days of really looking at this evidence, and the evidence continues to be developed and to be rolled out. So certainly from a WHO perspective, this is too soon to make those kinds of definitive statements. But what is really important is that the world is ready for that, and particularly that the manufacturers are doing whatever they need to do to be sure that if it's needed, we're not in a position as a world to be unable to deliver those doses.
So when we hear, whether it's drug companies or others, saying, we only know that there's efficacy for 6 months, is that only because these have basically just been invented and we don't have time tests? Is that
Yeah, that's exactly it.
Yeah.
That's exactly the reason, is that as everybody knows, that these are vaccines that have been around for a little less than a year, and certainly only in routine use for the past 5 months. And so really it's about the time that we need to look at what's happening with people's immune system after having been vaccinated and how responsive they are to these new variants, as well as the usual strains that are circulating.
Great deal of discussion in this country about second shots, but what essentially we should be doing with the shots we have on hand. A lot more of them now, and so Canada's begun vaccinating children age 12 and up. But I look in other countries, they're not even doing healthcare workers yet. Do you think that Canada is now at a place where it could or should redirect some of its available doses to other countries?
You know, the world is in a very inequitable place right now. So there are about 1.6 billion doses of vaccine that have been administered around the world. But in low-income countries and in low-middle-income countries, very few of those doses are going to those countries. We see that about 17% of all of the doses that have been administered in the world are going to those low and low middle income countries, but they represent almost 50% of the world's population. So you're right that we're in this position where the highest priority groups, those who are elderly, healthcare workers, social workers, have not yet been vaccinated in many, many countries. So it is time for countries that have broad access to vaccines to be sharing some of those doses with COVAX so that they can be distributed in a more even way, because we're not going to end this pandemic as long as the virus continues to circulate broadly around different parts of the world.
Canada's situation has certainly evolved considerably over the past, let's say, 2 months, where we've gone from not really having many doses to having a much more filled pipeline. And part of that way that pipeline is filled up is we've got 600,000 AstraZeneca shots that are sitting in storage right now because we got them from COVAX, the facility that is in large part intended to help lower income countries get access to these vaccines. Should Canada be considering giving those back now?
Well, this would be an amazing thing for COVAX and for countries that are receiving their doses through COVAX. We're really calling on all countries that have doses that they can share to do so as quickly as possible. First of all, there are expiration dates on doses, and the world is in a place where there's not enough supply to go around to every person who needs vaccine, at least not this year. Manufacturing is ramping up really quickly, but it's not going to solve the problem of today and this month and next month. So certainly for countries, Canada perhaps being one that could consider sharing those doses with the COVAX facility so that they can go to places that desperately need those doses.
Because Canada is the only G7 country to have actually accessed vaccines from COVAX.
Well, there are, as you know, there are countries, there are 190 countries that are members of COVAX, and some of them are countries that are procuring vaccines themselves through COVAX, and others are getting vaccines at no cost to the country. And so it is this mixture and it is this pooled purchasing power that lets COVAX really be the facility that it is. But many countries have done bilateral deals. And so it really is the moment for countries that have gotten quite far into their immunization program to really consider now is the time for doses to start being shared so that we can really end the acute phase of this pandemic and do that around the world.
Looking around the world, obviously different countries are in different situations, but when I think about travel, is it too early, does the WHO believe, for countries now to begin easing restrictions, for instance, this summer?
Well, our guidelines on how to manage travel and how to manage people coming in from outside the country really is tailored for each country. It really has to assess what's happening inside the country and what the programs are for keeping people safe in the country. We really do think that the vaccines are making a big impact, and we're again watching the data very carefully about the possibility for vaccines to also change the risk that a vaccinated person could transmit to somebody else. And the stronger that data is, the safer it is for people who are traveling across borders. But we don't want to have vaccines be the impediment for people to travel. There's still so much inequity in terms of vaccine, and there are ways that people can stay safe and do the travel that they want to do.
Dr. Kate O'Brien, thanks very much for your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.